94% of patients said they would choose the TECNIS Multifocal Lens again.
My vision for all distances is just wonderful. It's like it was when I was young. I can see as well up close as I can at a distance or halfway in between. And the phone book, that was the big test. After I got the TECNIS lens, I thought, I wonder if I can read a phone book now, because I could not read one anymore without a magnifying glass. And so I took the phone book out and I said, oh my gosh, I can read this. Before, when I would look at the yard, I didn't see the detail that I see now. It's so bright and brilliant now. The color is just so much more vivid. Every aspect of working in the yard has changed. It's a freedom to do anything as far as that goes. These are new eyes. That's what I tell everyone. I have new eyes. It's like a new world. I wake up in a new world every day.
Following the procedure, patients are usually allowed to return home in about an hour, and most people can resume their normal activities within a day or so. Everyone heals at a different rate, but in most cases, vision is improved within 24 hours and continues to improve in the weeks following the procedure. There may also be some visual side effects, such as halos and glare from lights at night, that are more common than with a monofocal IOL. Halos are rings of light that you may notice when looking directly at a source of light, such as oncoming car headlights. Glare is a scattered light effect that can appear around a source of light. As the eye adjusts to the new lens over time, the visual impression of rings and glare typically lessens or goes away. Most patients report that the ability to see near, intermediate, and distance far outweighs any visual side effects they may experience.
I see very clearly, and I don't have any halos around the lights at night. I can drive without anything.
If you suffer from poor vision or think you might have a cataract, you should make an appointment to have a complete eye examination. Once it is determined that you are a good candidate for the TECNIS Multifocal Lens, you will be given additional information about the possible risks, complications, and costs involved with the procedure. Be sure to have all of your questions answered before giving your consent to have the procedure. A very small number of patients, less than 1% in U.S. clinical studies, may be dissatisfied and request removal of their multifocal IOL. Under poor visibility conditions, your vision may be reduced more than it would be with a monofocal IOL. Under these conditions, you may have more difficulty recognizing some traffic signs and hard-to-see objects in the road. Therefore, you may need to take extra care when driving, especially in poor light conditions. In rare instances, multifocal IOLs may make some types of retinal surgery more difficult. Although the thought of having any kind of eye surgery can be a bit intimidating, it's good to know that such a tremendously successful medical procedure has just taken a giant step forward. By providing even greater benefits and freedom from glasses, the TECNIS Multifocal Lens may give you back your youthful vision.
I know I'm getting old, but I don't feel a dadgum bit older now than I did 50 years ago. Now when I play golf, I have no need to ask anybody where the ball goes, because I can see it further than they can. I contribute that entirely to the TECNIS multifocal lenses that we decided upon. I feel like now I do see as well as I saw 40 years ago.